Laura Sadler, who played Sandy Harper in Holby City, has sadly died. Her family have requested that we continue to transmit all the episodes featuring Laura as a tribute to her.
Fine. Louise Farley, she's 34, admitted to AAU with query appendicitis and cardiac chest pain. History of mitral valve disease, and she's scheduled for surgery in about 6 months.
Right.
Now, I know she's Mr. Adams' patient, but I was told to refer her to you.
Okay, good. And is there anything you need?
No, I'm just glad to be back to normal.
Fine. Just take it easy.
Alex, we weren't expecting you today.
Well, I heard there was going to be a trust meeting at 2.
Sister Williams. You abandoned your registrar at the critical point of an operation last week. We did think a meeting would be a good idea.
Apparently, the decision's going to be made today about my future.
That's the plan.
Well, I have some patient's notes that I have to follow up on, but I was hoping that at some point we could talk about my options.
You operated on patients knowing your Parkinson's might affect your surgical ability, Alex. I think your options are limited.
I thought I had it under control. Am I going to be sacked?
That's what the meeting's about.
Kath's away today, so if you want to use my office, you can.
Thank you, Chrissy.
Come on, Ed. That's why I'm here, to help. No, sorry. I didn't mean... I don't like hospitals. It's strange, really, the amount of time I waste in them. What was your name? Lisa. Thank you, Lisa. Okay. Professor Khan, have you got a minute?
For you?
I've just admitted a Mrs. Woods via the ED with severe vomiting and stomach pains.
Elizabeth, what are you doing here?
I keep being sick. Sometimes there's blood. Not so much lately, but since you found the ulcer.
Rick and I have been treating Mrs. Woods at the Hadlington.
Sticking a camera down my throat is hardly treating me.
Oh, you should see what I do to people I don't like. Is Anthony with you?
No. Actually, we're no longer together.
I'm sorry. I knew things weren't perfect, but...
It's been coming a long time. I finally did something about it.
Oh, good for you. No, I've got to be somewhere else. I'll get somebody to see you straight away.
Is it then? Another day in paradise?
Oh, what happened to all that youthful optimism?
So when did your stomach pain start?
After I came into emergency, my heart was racing in my chest. And then while we were waiting there, I started to get this, like a knife, you know, in my right side.
Oh, sorry.
Don't worry. Mummy's here because she's going to get better, isn't she?
Let's have a full blood count, use knees and a urine sample.
Sure. I've only just been.
Thank you. Pretend I'm not here.
Your stomach doesn't seem to be too tender, so I think we can rule out appendicitis. We just have to wait for the blood and urine results.
So it's got nothing to do with the heart?
I don't think so.
Thank you. Diane? Louise. I'm Mr. Campbell-Gore. Tom.
I normally see Mr. Adams.
Mr. Campbell-Gore's our clinical consultant.
That means I'm okay at what I do. I'd like to get Mrs. Farley up to Darwin. Yes? This your daughter?
It's one of them.
Try and relax, Louise. Your heart's beating irregularly. That's not unusual with mitral valve disease, so I'll give you some antiarrhythmic drugs. I'd like to have an echocardiogram. I'll see you upstairs. Thank you.
Excuse me. So you don't think pains in her abdomen are anything to do with the heart condition?
No, but let me know when you get the bloods back.
Tom?
Yes?
About the other night?
For our spot date, or you and Adams keeping his Parkinson's a secret from me?
Yeah, I was wrong about Alex. I'm sorry, really.
Well, I guess my issues ought to meet with him, but in future, Diane, be careful where your loyalties land you. Apart from that, were you wrong and sorry about our date, too?
Well, I'd hate you to think that I wasn't having a good time. Different circumstances.
What circumstances would they be?
Well, we worked together and... well, there's that whole blurred line thing, you know, between work and fun. And, well, I mean, name one person here that it's worked out successfully for.
You've worked in medicine long enough to know there are no absolutes. Well,
Hi.
Hi.
Who's the lucky guy?
Oh, I'm late.
Yeah, me too.
Are you?
What we like.
Except I'm not on the same terms with Chrissy as you are with Lisa.
What terms?
Well, you snogged her, then you snogged Jess, and then me. Nice of you to remember. But hurry up, I've got to get my money to Lisa before my shift starts.
This won't swipe. Oh, damn!
It's a library card.
Yeah, you're right. Do you mind? Sorted.
Congratulations. It's a latte. On the house.
That's Donald Holloway in from the ED. He needs a bed. Chop, chop. He's a lech.
Cute bum, though.
We agreed. New boy gets the cold shoulder.
Still. Look, you let men like him come between friends at your peril. She's got a point.
Yeah, I suppose.
There we are, Donald.
Don, please. Donald makes me sound like a duck.
62 presented with chest pains.
Okay, can we order an ECG?
I hate to make this kind of fuss. As a rule, I'm very healthy. Haven't seen a doctor in donkeys.
All right, just relax. We'll get someone to see you as soon as possible.
There you are. I turned my back and 5 minutes later you've got good-looking nurses at your beck and call.
Are you Mr. Holloway's daughter?
I'm his wife, but that kind of flattery will get you everywhere. On it, girls.
I'm going to take you out for an endoscopy. Have a look inside.
I didn't enjoy that much last time.
They're not very comfortable, but it's best that we check out what's going on. Did you have a biopsy before?
No, they said I should wait. You do them to rule out cancer, don't you?
Best to know what we're dealing with.
Maybe for you.
There's no need to worry.
I'll see you in a bit.
If you're late again, I'm going to have to consider giving you a verbal warning.
Yeah, I had to pay Lisa.
And patients' flowers belong on the wards.
Well, they're from me. To welcome you back.
Well, put them on the ward anyway.
Oh, and this came for you.
Chuck it away.
Yeah, but it's addressed to you.
Yeah, I know.
Hi. Can I leave this here?
Sure, yeah. I'm just keeping the chairs warm.
Oh, Chrissy's not in there. Alex is swatting or something.
Do you know where she is?
Yes, heading towards the lift transfer from AAU.
Okay, thanks.
Hi, Louise. I'm Sister Williams. A2, please. How are you feeling?
You're kidding. With 5 kids at home, this is the best line I've had in years.
5?
Yeah.
The other 4 are still at school.
Chrissy, are you okay?
Yeah, why wouldn't I be?
Well, I haven't seen you since the funeral.
Yeah, I know, and I don't need people keep reminding me, so can we just leave it?
Can I do it? I'm here to learn, like it or not.
Okay. Can you open your pyjamas, please?
That's an offer pretty young women don't make too often. Present company accepted, of course.
Make sure the patient's comfortable and not cold. Shivering can affect the reading. I'll leave you with Mr. Keaton.
Don, how you doing?
Oh,
Now tell me, when did the pain begin?
off and on all night. It got really bad this morning.
Can you describe it for me?
Like nothing I've had before. Indigestion, maybe, but nastier.
Were you doing anything strenuous at the time to make the pain worse?
Don's such a sweetie. He's trying to spare my blushes.
Oh, right, yeah.
You look surprised. Don and I are a very physical couple.
Love, I don't think.
He may have 20 years on me, but we're well matched. He still works out.
I was a wrestler.
All right.
In the heyday, not like these American ponces now. I wore a Zorro mask. Can still run an 8-minute mile on a good day.
Not today, though.
No, not today.
You asked for this?
Yeah.
What does that tell you?
Well, it looks like you've got a narrowing of your coronary arteries done. Now, you will have to have a coronary artery bypass graft in time. But for now, the cardiologist has prescribed you with a glycerol trinitrate. That's GTN spray to hold your condition. Are you on any medication?
No.
Okay. Well, once you've seen the cardiac rehab nurse, you're free to go home. You know, my dad used to take me wrestling all the time. It used to really inspire me.
Oh, really?
Yeah, I'd see you guys rolling around and hugging each other, so I took up boxing instead.
I bet you're more like the honey monster. Scary from a distance, cuddly close up.
The gentle giant. It's an act that's been working for him for years. Don used to be a real one for the ladies.
Sounds familiar. Now, you need to put this under your tongue and squirt twice. Repeat whenever you feel any pain in your chest.
Like that.
Perfect. Takes a few seconds to work. You need to carry it with you all the time.
I'll have to get you an handbag. How are you feeling?
The pain in my side isn't so bad.
The pain in your neck's still here, though.
I didn't say that.
You want us to go home?
Well, Debbie needs picking up and taking to dance class. The boys have got rugby. Then who's going to look after Sally?
I can leave Sally at your mum's. Sometimes it's like mobilising an army.
Really?
Hello again, Louise. Thank you, Prissy.
Have you found out what's wrong?
Well, I think the palpitations you've been experiencing have been caused by a deterioration in your mitral valve.
What does that mean?
Well, concentrate. Here comes the science part. The mitral valve has two flaps, okay? And when the blood flows through, the flap should close. But in your case...
She was waiting for an operation for that.
I know, but having looked at the echocardiogram results, I think we're best if we got on and repaired the valve this afternoon.
Today? But only came in with a pain in my side.
No panic. I just think it's best if we got on with this straight away. Yeah?
Sounds like it's going to be a long day, so maybe you should take Sally home.
Will you be all right?
Yeah, of course. This is Professor Cant.
Zubin, it's my job to put you to sleep. Does Mummy like lullabies? Well, if Tom will sing harmony, we'll see what we can do. I have a few questions.
I'll leave you to it.
Us too. Come on, let's say bye-bye to Mummy, eh?
Bye-bye, son.
Do you have any medical problems apart from your heart that we should know about?
No.
High blood pressure, diabetes, asthma?
No. What if I wake up in the middle of the operation?
You'd scare the hell out of us all. You won't wake up. I've been a consultant for over 15 years. No one ever has. Louise, my father played cricket. Silly Medon. He had this gift of never dropping a catch. He never took his eye off the ball. I'm the same. I've never dropped a catch yet. Any questions?
I'll definitely be operated on today, won't I?
Definitely.
Is the pain getting worse? Sometimes I'm really good at putting it out of my mind. I guess I'm too cluttered at the moment.
Is there anyone from home you want me to call?
No, thanks.
So you've been under Professor Cant a while then?
7 years. Sometimes I think of him as my guardian angel. You know, when the pain gets too bad, he's always there.
We could all use a guardian angel, especially a gorgeous one like him.
How's she doing?
Yeah, the pain seems to be getting worse. It can't just be an ulcer.
She suffers from osteoporosis. She's a proud woman, hates people feeling sorry for her.
How long?
Misdiagnosed for years, so her faith in doctors is seriously tested from time to time.
She's nice.
Well, that's a compliment coming from you.
Well, you know what people can be like. When I've broken a bone, I always get that look. Abused wife. Oh, so you've fallen down the stairs again. That's why I like you. We have a shorthand.
Oh, and I thought you came to me for my boyish good looks.
You know, my mother only gave me one thing before she left, and that was the determination not to let this stupid disease ruin my life like it ruined hers.
Finished?
Sorry.
Don't be. I need to check your back. It's there, isn't it?
Mm-hmm. Really stabbing.
Turn on your back again. Must be worse now you're off the painkillers.
Yes.
I could organise an epidural for you today, but it won't be me, I'm afraid. I'm swamped.
I'd rather it with you.
Okay, I'll see what I can do. I'll get Lisa to get you ready.
Thanks.
My wife used to get worked up like you.
Did it annoy you?
Not at all. If I have a fault, it's that I'm far too laid back. Your epidural will probably be in about an hour.
Thanks. I know you're doing me a favor.
I'm storing them up. One day I'll cash them in.
Okay, you're going to feel a small scratch?
Hate it, hate it, hate it.
Doing great. All done.
Sorry. I'm rubbish at having my blood taken.
Oh, I've had worse.
At least Jack's not here. He can't stand the sight of it.
He's got enough on his plate, hasn't he?
People think we're mad for having a big family, but I was an only child. The noise of 5 squabbling kids drives us crazy, but an empty house would be worse.
After a long day here, an empty house, godsend.
The thing is, it's not all about screaming and changing nappies. There's stuff they never tell you.
Yeah, I'm sure. Louise, is your husband about?
He's with the troops back home.
All right, okay, well, I've got some good news for you.
The test results?
Yeah. It looks like the pains in your stomach are completely natural. You're pregnant.
Again?
Nick, I want you to do Mr. Holloway's obs till I can find something more unpleasant for you.
Look, I'm sorry if I've upset you girls.
Girls? Is that what you think we are? Think we might fall to pieces with one of your little boy's smiles? You're going to have to try a bit harder.
Why is it whenever you pack up to leave, you end up with more stuff than you brought?
I give up.
Only ever been in hospital once. Got my shoulder all messed up in a bout with unlucky Jim. I was there 2 weeks. Not a single visitor. That's how I knew I'd been on the road too long.
Now, I made the of a boy, and you can forget 2 weeks. That nurse said we can be on our way.
You got anybody who'd sit by your bedside?
Yeah, my sister. You okay?
My chest. God, it hurts.
Hey, can we get the bed flat? Don, can you hear me?
BP's 90/60.
We need to get him attached to a monitor. Nick, page Mr. Keating. Okay, Don. That's it.
You still look shocked. I am. I'm on the mini pill.
How do you think Jack will take it?
How he takes everything. He's convinced it's all fate. When Sally was born, he said we were meant to have a big family. When I was diagnosed with valve trouble, I said, was I meant to have a bad heart?
You almost sound disappointed.
It's not how I planned it. And now it's all out of my hands.
So what do you want?
All I know is I'm divided up as far as I can go. There isn't any of me left to give to another baby.
But you wouldn't get rid of it, though, would you?
I don't want 6 kids.
The GTN spray should have worked.
Definitely used it. I saw it.
So did I.
And why is he this hypertensive?
Nick, can you take Mrs. Holloway to the waiting area?
Sure. Could you come with me, please? He's acutely ischemic. That's not good. Right, okay, we're going to have to get some colloids in. I think we need to do the bypass graft today.
I'll page Mr. Campbell call.
Can you give me 6 units of blood cross-match for theatre? Okay, let's go. Let's move.
Hey, look at this. I was bumped by this airline a couple of months ago and they've sent me tickets to Paris to say sorry.
All right, for some.
I won't take you then. You all right?
Kind of. Have you seen Ethan Hope around?
No. Why?
Tom's asked him for a report for that meeting with the trust this afternoon, and I want to see him before it starts. I know he's my neurologist, but he can be a bit unpredictable, and I really need someone in my corner.
Well, you know he can only give you his professional opinion.
Meaning?
Well, self-medicating was really stupid, and I should never have covered for you for so long.
When it's your job on the line, you can say you told me so. I did myself more harm self-medicating than the trust could ever do.
Is the trauma getting worse?
Burn the anti-sickness pills for that.
Congratulations.
Understand congratulations are in order.
Thanks. Does being pregnant affect the operation?
Yes, it does. And it means we need to make a choice. If we go ahead with the valve repair today, it does carry a certain risk to the baby. It's not a high one. I'd say there's a 1 in 10 chance that the operation could result in miscarriage.
That might not seem high to you.
Well, I'm sorry. It's just a statistic, you know.
What if I don't have it?
Well, pregnancy could put more strain on the heart through fluid overload.
So it's possibly lose a baby today.
Well, 1 in 10 aren't bad odds.
And maybe lose us both during the pregnancy.
Sorry. Forgive me, I do need to take this. Just think about it. Talk to your husband. I'll see you later.
Do you think 1 in 10 is high?
I think you'll be all right.
I don't want to be all right. If something goes wrong, it won't be my fault.
I think we should discuss that with your husband.
I know what he'll say. He'll say we're meant to have more. I can't have more. You think I'm heartless?
No, I don't.
Ethan, do you have a minute?
I'm not sure we should speak until at least after the meeting.
What are you going to tell the trust? I need to know about my options. If they don't terminate, I can't...
We'll stick with what I put you on. Dopamine agonist and titrate up more slowly to a dose that might control your tremor.
What about levodopa? Well, there must be something else then.
There are a couple of places in the country doing deep brain stimulator surgery.
I should try that.
They wouldn't even look at you at the moment. You've got to give the drugs a go first.
I have.
Do you open your presents? Christmas Day or Christmas Eve?
What?
When do you open your presents?
We used to wait until after the Queen's speech.
Exactly. You can't rush these things, Alex.
Thanks for taking the trouble.
Well, it took a bit of juggling, but I'm good at that.
I know.
Your biopsy's scheduled for around 3. No sense in worrying about what we don't know yet.
Easy for you to say. Nobody's checking you for cancer.
We're just looking. Okay. Let's sort out the pain in your back.
How's that?
It's great, thank you. Okay. Little scratch. I'm numb yet?
Yep.
Okay. Lie very still.
I know.
Okay. Looking good.
Well, I'm impressed. Sometimes that bit takes you ages.
It's okay. You caught me on a good day. Okay. Here's looking forward to a few more months of pain-free movement.
Well, hopefully with Anthony gone, it'll be more than a few months.
Just lie on your back.
Mr. Holloway was on his way home. Yes, so did I. But he started showing ST depression on AAU. I know your list's full today, but I had no choice. And he'd been prescribed GTM? Well, the angio only showed single vessel disease, so unusual. Scalpel. Still, he's a big man. Thankfully sleeping like a baby. Or we'll need a vein rather than an artery. So we've got time for it. So, any time this month would be good. Thank you.
Any news?
No, but as soon as we have some, we'll let you know.
Such a gentleman, Don. I so wish he'd been Shelley's dad. Not that she speaks to us much. Me marrying a man older than a granddad. But we're so well suited. 20 years isn't so much, is it?
I don't know.
Yeah, you think so. Loads of people do.
It doesn't mean that they're right. Like you say, he's a good 62.
He didn't look it. He suddenly looked his age. Older, even. I didn't realise a big man could look so small.
You know, Don said he wasn't on any medication. Was that right?
Yeah. Why?
I was just told to ask. There's nothing to worry about. Someone will let you know as soon as he's out of theatre. I think we're about ready to do Mr. Holloway's bypass graft, nurse.
Is the defibrillator on? Yes.
Cross clamp. Thanks, Tim. Down on the floor. Saw Alex in Chris's office this morning. Looked like a lost sheep. Sure he did. Scalpel. So his case not looking too good then. I should be enjoying this more, really. Had it coming to him. He's a good surgeon, though. Very understanding of you. When he put his own problems before the welfare of his patients. Dug his own grave. Not a thing I could do for him. Hold the other side of the ventricle. Yep, got it. I wonder what you'd have said if Rick had taken the same attitude with you. Forward prolling. Thank you. It looks nice. Keep the tension. Yeah, graph's lying nicely. With a bit of luck, Don will be able to go a few more rounds.
Mr. Adams, hiya. I was hoping I'd see you today.
Mr. Farley, how are you?
Great. Same as ever. We wondered why you weren't treating Louise this time round.
Well, I have a big research case on at the moment, unfortunately.
Oh, right. Well, she always rated you.
Well, I'm sure she'll be fine with Mr. Campbell.
So what's the plan out?
Of course. Nothing to it. Don't tell Louise, though. She'll want me doing this every day of the week.
You all right? People leaving you alone to do your work?
Too alone. I'm beginning to feel a bit like a leper.
I'm the opposite. People won't stop asking me if I'm all right.
Bad day, huh?
I wouldn't say it's one of my best, no.
Well, at the risk of annoying you more, want to talk?
No, I'm fine, really.
Well, here I am, in your office.
Hi, you heading up to the trust meeting?
Yeah. This is my psychiatric report, Alex Adams. Do you want to have a look?
I'll have a look at it up there.
I'd obviously like to see Alex again, but that depends on the trust decision.
I don't think you'll get a chance.
Well, I think that would be a terrible waste of a good surgeon.
Anita, there's only so much I can do, you know.
Well, that's rather defeatist for you, isn't it?
Look...
Tom, sorry. Do you have a minute?
not right now, Dan. I'm not saying that. It's just that
I always said 6 was our lucky number.
Last time you said 5 was.
Well, now it's 6. Oh, you've got to admit it's fated. I mean, not even the pill can stop our family from growing.
It's not funny. Jack, I can't go through another 8 months feeling like this.
So what do you want to do?
I think we should go ahead with the operation. I know. It's a lot to take in.
Oh, I just want to jump up and down and be happy. But there's a chance we could lose it.
There's a chance you won't.
You'll be fine. You both will.
So shall I tell Mr. Campbell-Gore you're going to go ahead with the operation?
Yeah. Tell him I want my wife to be better, but I don't want us to lose this baby.
Mr. Adams knows he should have spoken out once his Parkinson's had been diagnosed.
Well, that's something.
He knows potentially he's looking at the end of his career.
We'd be well within our rights.
It's within my rights to buy a bungalow in Scarborough. Doesn't mean I'm going to do it.
The Trust can't tolerate this kind of dishonesty. Mr. Adams could have put patients' lives in jeopardy, and though I sympathise with his plight...
But, as I said in my report, I think that he's learned from all of this. He isn't clinically depressed, and luckily nobody was hurt.
It's the key word being luckily.
What kind of message do we give to our patients if we're ready to dump one of our own colleagues just because of a treatable illness?
Tom?
No, I was overthrowing him out.
I'm inclined to agree. He left under a cloud last time.
But Anita's right. Self-medicating isn't illegal, and it's a shame to waste a perfectly good surgeon.
But after what he's done...
May I make a suggestion? Why don't we transfer him over to outpatients? It's non-surgical, and a job he's more than capable of doing.
Overly capable, I'd say.
At least he gets to keep his white coat.
It's a solution.
Well, ultimately, Simone, the decision's yours. I don't mind one way or the other.
Okay, young lady. I've tried sticking a big needle in your back, and that hasn't put a smile on your face. No, time to bring out the big guns now. My wife gave this to me for luck.
Oh, Simon, you can't.
Figured you could do with some.
Thank you.
It's supposed to ward off evil spirits as well.
It'll keep you at a distance then?
If that's what you want.
No, I don't. I'm not sure I can do this now.
No, you won't be. I've arranged to administer the sedation myself.
I mean later. I mean cancer.
You don't know it's cancer. You have got to stay positive. Don't give in to it.
It just feels like one illness too many.
Elizabeth.
I'm scared. He's got that butter wouldn't melt look.
Yeah, which works for me.
You going soft on him?
No, but there's nothing wrong with a little bit of eye candy.
It'd be so much easier if he wasn't. Nick, when you've taken Mrs. Holloway up to Darwin, can you check each patient's bowel movements, please?
What's this about?
What?
I've been booking perms for the mobile hairdresser, been back and forward to the pharmacist for all kinds of ladies' troubles. Now you want me to interrogate the patients about the toilet visits?
We just want you to do your job.
I feel like I'm being singled out.
Well, what makes you think that?
Look, you think I'm this person, and I'm not.
Yeah, whatever.
I've spoken to the staff bank. They want me to split my shift, do a stint upon Darwin after lunch.
Are you bailing out on us?
And the fun was only just beginning.
I'm not here to be played with.
What makes you think we're playing?
Look, whatever you both think happened at that party, you're wrong.
Do we look stupid?
It's not like I had a choice in the matter. Because if I did, we wouldn't be having this conversation. I didn't want to kiss either of you. Didn't then, and don't now.
It took a bit of persuading, But they've allowed me to offer you a job in outpatients. Obviously, occupational health will be monitoring your progress. Surgery will be off limits, but at least you'll still be employed here.
Outpatients? But I'm a surgeon. I have 10 years' experience behind me.
Alex, the trust wanted you out. I had to fight for you. Don't make me regret that.
Surgery's my life.
Well, outpatients can be taxing too. There's a variety of challenges to face every day.
Show me the PR spin, a few chats with the patients, a quick look at an X-ray, maybe an old wound if I'm lucky.
Well, as I said, it's the best I could do.
What if medication settles things down? Can I come back?
Well, we'd have to review that, but you're talking months.
Well, Ethan mentioned there was a possibility of deep brain stimulator surgery.
You're clutching at straws. I'm due in theatre with Louise Farley.
Yeah.
Hi.
Hi.
I've been told to work my second shift up here. What's this?
It's for patients in Bay 2 and Bay 3. You need to ask them if they open their bowels today and then just write their comments in the little space provided.
Yeah. So you spoke to Jess and Lisa then?
But I'm sorry, they're my mates.
Yeah.
You're Nick?
Yeah, hi.
What's this?
Patient bowel movements. Sandy just gave it to me.
I need Sandy to do something, so why don't you familiarise yourself with the ward for a little bit?
Well, OK, thank you.
Chrissy, is Mr. Holloway back from recovery yet?
Mr. Holloway?
Don Holloway, emergency CABG, broke from theatre about half an hour ago.
Yeah, he was taken into HTU.
Late night?
No, just a busy day. I'm not losing it.
Right, well, I never said...
Mr. Holloway, how you feeling?
Like I went 12 rounds for the world title.
You got me stumped. The spray should have eased your pain. Well, there's a lot less activity, but not as much as I'd like.
Will you have to go back into theatre?
Well...
Don, you told Mr. Keating this morning that you weren't on any medication.
He isn't.
Yeah, well, some pills fell out of his wash bag. Would you pass me that? Thanks.
Thanks. Sildenafil. These are performance enhancers. Mr. Holloway, I put you on a nitrate-based medication. It reacts badly with sildenafil. You should have told me about this.
When you said medication, I thought of prescribed stuff, like from a doctor.
Where'd you get them from?
A pal. Well, I didn't think it counted.
Well, it does count. And it means your operation today could have been avoided. It could have been months, even years before a graft was needed.
We're sorry for any trouble.
I'll speak to you later.
Well done for speaking up like that.
Thanks.
Not just a pretty face, are you? Well, there's no active bleeding that I can see.
That's a good start. See, one thing at a time.
Can you open the biopsy forceps? I'm just taking a small piece of tissue and close. Right. Let's get this to histology. There's a little bit of gastritis down there, but as far as the ulcer goes, it's quiescent. It's old blood that she's been vomiting.
That's positive news.
We just have to wait for the biopsy results.
Why didn't you tell me you needed pills?
I was worried how you'd take it.
What's that supposed to mean?
You've got it into your head that I'm this great lover. It's a lot of pressure. You said it. You're a very passionate woman.
I've just got to change this.
Okay, lad.
I can't believe you put me through all that. Seeing you like that, seeing you so...
I didn't do it on purpose, love. The good thing is, because of the graft, I won't need that spray. I'll still be able to use the pills, if we wanted to.
I'm not a maniac, Don. I thought everything was going great. Don't you think that's all I care about? If I've got you all wrong and you're not this great lover...
Look, I'm sorry, I'm almost finished.
Maybe you should just open your mouth and say so, instead of sneaking behind my back and taking flipping pills.
How's Mrs. Farley holding up? She ready?
More than ready.
What do you mean by that?
Doesn't matter.
Anita, why don't we celebrate our good deed for the day? How about that dinner?
Oh, so there are some things that you don't give up on. Still, I'm not sure that assigning a competent surgeon to out patients could be considered as a good deed.
Well, I stopped him being sacked.
Just be careful how you tell him. Give him some hope at least.
You've already told him.
Well, after the meeting, he had this bizarre idea he could continue as a surgeon. Why doesn't he come and talk to you? Discuss his adjustment issues. What?
Oh, there was me thinking that you'd actually thought about this. Just forget about dinner, okay?
No, come on, let's talk about it. What?
No, I'd rather not. And if you've got any issues adjusting to that, then you should take them up with someone else.
And how's that?
Much better. I hate just having a view of the ceiling.
Mr. Holloway,
Yes, sir.
how would you describe your bowel movements since this morning?
I wouldn't rightly know. I'm not generally given to describing them.
Regular?
Regular sounds about right.
Thank you.
Look, Sandy, I'm really sorry. I didn't mean for you to...
That's the trouble with being a ladies' man, same as me with Candice. You get given this reputation and you find yourself living up to it. Bit of honesty never hurt anybody, right?
I'll try and push histology for a few answers today.
You'll be lucky.
You just got to know the right people. I'm scheduled to be in theatre with Louise Farley. Thanks for your help.
You're not going to believe this.
Why? What's happened?
I've been posted to Siberia. Outpatients. No more surgery. Oh, yeah. And I'm supposed to be grateful.
You're too good for that.
Yeah, well, Tom had the nerve to say he was doing me a favour.
He's in a really difficult position, Alex.
Oh, come off it. But he enjoyed every minute of that meeting.
Well, do you want me to? I mean, I could have a word with him.
No, thanks. I think Tom said enough on the subject.
Just keep breathing normally. You might start feeling sort of drunk.
Last time I was drunk, I danced on the table.
You dance on the table and I'll get drunk. Okay, that's it. Just relax. I want you to imagine you're drinking coconut milk on a sandy beach. And when you wake up, I'm sure your heart will be better and your baby will be fine.
Maybe it won't.
Ready to go?
She's out.
These are the only ones we had.
Perfect.
Since when do you read gardening magazines?
I've been thinking of one or two things I'd like to do to ours.
What's going on, Don?
I'm tired of pretending I'm not 62.
Well, who's pretending? You're a great 62.
I don't feel that great.
We'll have you up on your feet in no time.
Then what?
What do you mean?
How many miles a day do I have to run? How exciting do our bedroom antics have to be?
I'll leave you to it.
You were right. I should have told you about those pills, but I didn't think you could handle it.
Handle what?
You married a man 20 years older than you.
I'm proud of the man I married.
I'm worn out trying to keep fit. So you don't have to face the fact that I could be using a free bus pass. I'm tired of taking pills so you never have to ask the question you've been avoiding this last 5 years.
What question?
Will you stay with me when I stop being a young 62?
But I love you.
Enough to let me grow old? Enough to buy me gardening magazines and let me sleep in some mornings?
I don't know. You want honesty? There it is.
Then maybe you're with the wrong husband. You should go then.
So you nearly died today. I'm not ready for that. I'm only 41, for God's sake. I shouldn't have to be thinking about my husband dying.
So to your tie-crimp platinum stitch, I want you to pick it up the base of the excision so both edges are approximated. Come around this side. I'd like to suture along the edge of the mitral valve for a proline. Get Mrs. Farley back to her family in no time. And keep up the tension.
Pressure's down to 40 despite vasoconstrictors. Can we add 2 units of blood to the bypass circuit, please? Have you got a bleed?
No idea. Check the abdomen. It's not distended.
It's still happening. It's down to 30 and dropping fast. I'm putting in a second line, but we're going to have to fix this soon.
Nothing in the chest. We've got a PV bleed. Page the on-call obs registrar. She might be miscarrying. No way of telling. We're just going to carry on as we are. Can you keep her stable till we finish?
I'll try. Rapid infuser, please. I'm going to give more volume. We're going to have to order some more blood.
Keep it topped up. Let's get some FFP and platelets in for when we bring her off bypass. Rest of it's out of our hands.
How much longer?
Soon.
I can't cope with all this waiting.
It's tough, isn't it?
I'm sitting here wanting news and not wanting it in case it's bad all at the same time.
Can I get you anything?
My wife and baby through this?
Well, we're doing all we can.
I keep telling myself, if we lose the baby, it'll be okay. After all, it's just cells and stuff. It's not a person yet. Like that helps.
Hiya, Mubs. Almost done.
Prof, I'll do a quick examination now then, yeah?
Go for it.
You ready to close? You all right, Mubs?
Nearly there. Could you help me lift the knees up?
Repair looks good. Let's get the valve tester. No leaks. Looks like a valve's been saved. Good. Excellent job. Well done, people.
How's the baby doing, Mubs?
Well, she's a large PV bleed.
She lost it?
Not looking good. I'll need to do a scan.
Do you need anything? I'm going off shift soon.
No. But thank you.
I saw Mrs. Holloway leave earlier.
I don't think she's coming back.
Oh. I'm sorry.
I had to say what needed saying.
Well, I'll see you soon.
I hope not. If you know what I mean.
Hey! Right. You can think what you like about me, but at that party, you were the one. But not that you're going to believe me anyway, which is okay. I just wanted to let you know, right? Fine.
Sorry.
Curtains are hard to knock on, I guess.
It's not cancer.
What?
It's just an ulcer. You're fine.
Oh, God, Susan. I didn't dare. I was sure. I can't tell you.
I know. You know, the strange thing is, I didn't want to say anything, but you did have me worried as well.
Really? You always hide it well. All calm and sorted. It must have worked.
No, please. Keep it.
Thank you for looking after me.
Hello, love.
The baby.
Oh, love. Fine. Both of you. You're going to be just fine.
Louise is a lucky woman, you know.
I knew she wouldn't lose the baby.
Well, easy to say that now. Well, I'm done for the day, so...
Bye, Alex.
Alex, I heard about outpatients. I'm sure you're really gutted. I just wanted to say best of luck, anyway. Well, that lady isn't singing just yet. Nope, hope not.
You don't have to actually see me to the taxi.
Oh, of course not.
Would you thank Miss Lloyd for me?
Oh, of course.
Right, well...
Yeah.
Okay.
I'll, talk to you after the weekend, and, I'll see you at your next epidural.
A month or two?
Looking forward to it.
Okay.
Or maybe...
Yes?
Maybe you'd prefer to see somebody else.
Why?
I could introduce you to another anaesthetist. Here, she's a great lady. You'd like her.
But I like you.
And I like you. Enough not to want to be your doctor anymore. I mean, if that's okay with you. We could go out for a meal. Have dinner.
Well, that sounds... I'd like that.
You're not listening to me. I can't go through with having another baby, Jack. Why is it when you want something, it gets taken away from you, and when you don't want something, I wouldn't give a single one of my children up. But there's nothing left of me to give.
We've managed before, we can manage again.
I don't want to keep on managing. We've only just got out of the no sleep, always tired phase. Sally's finally going right through the night.
I mean, look at Debbie and Thomas. I mean, that's the joy of having kids, to see them blossom the way they have.
Absolutely. But no more, Jack. I can't have any more.
So what are you saying?
I went into that operation, hoping to lose our baby.
You don't mean that.
They told me the odds, I hoped they'd be higher.
Oh, Lou, why didn't you say?
Well, what mother hopes for that?
Look, you're tired. You're tired and emotional.
I want to be the best mother to my kids as I can be. And I think that means not having another baby.
We tried to lose our baby.
Jack.
Hoped you would.
I can't believe we're actually doing this.
We're just two friends out enjoying a meal.
You know, when you're used to seeing someone on telly and then you actually meet them face to face, they're never how you expect. You know, fatter than you thought or taller.
I suppose.
You look different outside the hospital. I'm used to seeing you around machines and beds and nurses.
You're disappointed?
No. You're more real. Did you used to bring your wife here?
It was one of our favourite homes when we first moved to Holby. I haven't been here for years.
Well, I could see why she would love it.
You should see the bedrooms. No, sorry, I didn't mean that.
Do you remember when we first met?
I was just before my wife's accident.
I had a double fracture to the shoulder. I can't remember every break, but that was nasty.
Anthony seemed very sheepish, and I just thought that he...
You're not the first.
No, I know.
But tonight's not about him.
No, Mum Cars. I wanted to touch you all day.
I've been wanting you to for years.
What?
I want to see the bedrooms.
All of them?
One will do.
Check, please.
You're so beautiful. Is she medically stable? You know.
Mentally? Yeah, I think so.
But to do this, can she do it if I don't want her to?
Yes.
Then I haven't got a choice.
Well, you've got a choice whether you go in there and support her. Losing a baby's hard to cope with, even if it is what you want.
You'll be kept here on Darwin for observation, but in a couple of days we can certainly arrange for a termination if that's what you want.
It is. Think about what we've got, not what we're losing.
I'll make the necessary arrangements. We'll transfer you down in a couple of days.
Tom,
Yes?
are you really assigning Alex to outpatients?
Did he ask you to speak to me?
No. We're losing a good surgeon.
You put people's lives at risk.
Over the years, how many has he saved?
What do you expect me to do?
He's got
got a disease. Help him fight it. You operated on people in the past when you shouldn't have done.
That's just maybe.
Given a second chance, why can't
I've
he?
done everything I can.
There must be something else.
You're very persuasive, aren't you? I'll think about it.
Thank you.
Yes.
I've got some free tickets to Paris. I was thinking about a long weekend.
You asking me to Paris?
So it depends on your answer.
You're inviting me to Paris? Well, this hasn't happened to me for a long time. Sure. Why not?
Good. Good.
Hello there.
You're back?
Apparently.
I mean, are you back? Thought you'd... for good.
Me too. I couldn't find a pipe shop.
What?
But I hope these are nice and snug. No promises. Just see how things go away.
I'm not saying I'm ready for the scrap heap yet. It's just, if I keep going at the rate we were... What are those?
I bought myself a pair. In case I get cold feet.
Mrs. Holloway's back then.
Cool.
So you meant what you said then about the party?
Yeah.
Because the thing is, I was a bit drunk, so when we kissed, I reckon it didn't mean that much. Can't remember it at all, to be honest.
Well, I could refresh your memory.
Go on then.
I never thought it would happen. So often when you were treating me, I just wished that your hands touched me longer.
I wanted to.
Anthony used to get so jealous. Because he thought that you and I... And one time when we fought, I got so angry because it was what I wanted, but I couldn't have it.
He never treated you the way you deserve.
He wasn't always so bad.
You've wasted a long time defending him.
You're right.
But you and me, well, let's not get ahead of ourselves.
You and me would.
You make me want to say things that belong in those greetings cards, you know, with the cheap rhyme on the front and the big red heart.
Oh. Oh, room service. Can we order breakfast in bed? I love hotels.
Oh, that's a shame. I was going to take you back to my place and cook you breakfast. I do a mean eggs Benedict. It's not mine.
I know.
Aren't you going to answer it?
Hello? Oh, hello, love. Yeah. Oh, did I? Oh, I thought I said about 9. Right. Yes, just having dinner with some girlfriends. Beth and Gemma? Nowhere fancy.
What?
Hi. About earlier, I might have overreacted. It's just Alex, bureaucracy, stuff like that really winds me up.
I didn't need to be so tough, and I'm looking into some other options for it.
Great. I seem to remember an offer of dinner. How about this weekend?
I'd love to...
What?
Something last minute came up, and I...
And you like playing games, don't you?
Some people...
Good. As long as two can play.
I have to go.
was this about you leaving your husband?
It's not how it seems.
I think it's exactly how it seems.
Can we talk about this another time?
You think this is going to happen again?
When I said about me and Anthony not being together anymore, it's what I wished. Every day I wished that he would go. But it's complicated.
Grubby affairs often are.
I never meant for things to go this far. I just couldn't help it.
I let you into my life. And for what? You fixing your knickers before your husband finds out. Very romantic.
If you knew how much you affect my life.
Do you know what I've put on the line here?
I'm not your patient anymore.
I'm not talking professionally. This wasn't about sex or company. This was me finally taking a chance on somebody. You better go.
I really have to. I'm so sorry. I'll call you.
Please don't.